They describe it as the butterfly disease, that the skin is so fragile
that the lightest touch will tear their skin off.
I'm born like this. My skin is missing a mineral, so I lack minerals in my skin that bind it together. It's hard for me to heal.
I would say it's probably the worst skin disease you've ever known about, probably never heard about.
I never knew something so horrific could exist. It is so devastating to see something so horrible that these kids have to go through, and knowing that it's never going to get better and it will never go away. So it's a part of their lives every single day. It affects males, females, every race equally.
It is a skin disease, but it also can involve the insides, so the inside of the mouth, the teeth, the eyes, the inside of the gastrointestinal tract, the lungs, all the way down to the end. And so it's essentially a disease that can be inherited from person to person. You can be the first person in your family, and there's a defect in the protein that attaches the skin to its second layer. So it's really what, if you think of a carpet, it's almost the tacks that hold the carpet down to the first layer that are missing. And so the carpet can easily come up when someone walks over it or slips on it. And that's exactly what happens with various forms of EB, some being more severe than others. The skin may blister or slough off at the slightest touch. Other children that maybe not be as severe, it may take a significant pressure on the skin to really create a blister or an erosion. And this can happen in the mouth with simple chewing, coughing, swallowing something wrong, trying to go to the bathroom even.
For Lizzie, it tears the skin or creates a blister. The treatment is basically make her feel better when she gets a blister. We put Vaseline on it, Aquaphor on it. We cover them up if there are open wounds. We try to keep things clean to make sure that there isn't infection. But for the most part, there is no cure. There's nothing that we can do on a daily basis to stop EB.
Riley is almost 5 years old. He'll be 5 years old next week, and he was born with Epidermolysis Bullosa. He has generalized blistering, so he can blister anywhere on his body, but he tends to blister more on his legs, hands, and feet.
If you see a person on the street, you're going to see them with bandages, some from the neck down to the feet. Some will only have maybe part of their limbs, part of their arms, part of their legs bandaged. Depends on the type as well.
They look like blisters sometimes. Sometimes he'll actually have skin tear off. Either fill with fluid or with blood, depending on probably where it is and whether there's a vein right there or not. We actually have to lance the blisters to keep them from growing because they are fluid filled and they'll just grow and grow. They won't stop, so.
It's just a yucky. No, no always. Just a yucky. Okay, can you do that? Can you do that? Yucky.
When you're a child, it can be really tough to take the pain. So. When I was younger, I was born with fingernails, but I had to remove them more for my safety and better of health because like with my kind, the nails can grow in crooked, I guess, and weak. So in order to not like hurt yourself or snag a nail, like I removed mine. And it's probably a better idea because I might have lost them when I got older. So
A lot of the scarring forms of EB, like the recessive dystrophic, like the junctional, you will also get blisters around your cuticle area and underneath your nail, and then usually your nail cannot stay adherent to the nail bed itself, and so you'll just end up having a scar.
I want to give this opportunity to say how much I love my sister Lizzie. And my sister is really kind. She has a skin disease called Epidermolysis Bullosa.
I don't find a lot of people that have mine, so it's kind of surprising when I do. It's called junctional, and I believe I have junctional non-Hurlitz.
So the simplest way to explain it, there's 3 types, simplex, junctional, and dystrophic.
She has the simplex version, generalized, EB simplex.
Dowling-Mera subtype, a simplex subtype.
Simplex being probably the most mild form, although there are many subtypes in each category. Some of the children may have just blisters on the palms and soles, others may have head to toe blisters.
But keep in mind that just because it's called simplex, it's not simple. They still have large blisters, they still have open wounds that are painful, they still require dressing changes, they still require frequent office visits, they're still at risk for infection, they're still at risk for potential malnutrition, things like that.
The junctional type, which is quite rare, where the defect in the protein is a little bit deeper in the skin, and thus you'll get more scarring of the skin. And they oftentimes either will die very young in infancy, and there's another subtype which they will live a little bit longer but have much more severe disease.
A very shortened lifespan, usually not past a few years of life. They usually don't make it past that because they have severe airway involvement.
The most common type we see is dystrophic. Dystrophic, again, has many subtypes, and again, it is one of the most severe forms, unfortunately. Children's hands and feet blister so much that they essentially fuse and they don't have function, and they have what we call a mitten deformity, which is essentially like this.
They're going to have significant scarring over their lifetime. They're going to suffer from frequent infections. They're going to have malnutrition issues. They're going to have iron deficiency anemia. They're going to have social issues, emotional issues. There's a lot of things that go into EB. Just because it's a skin disease, it's not only limited to the skin. It's really multi-system, multi-organ.
It's such a rare condition that, I mean, we had never heard of it.
Never heard of it.
And then we went to Phoenix Children's Hospital.
I am a pediatric dermatologist here at Phoenix Children's Hospital. I'm also co-director of the Epidermolysis Bullosa clinic here.
Well, I've been a nurse at Phoenix Children's Hospital since 2009. I knew I always wanted to be in a clinic setting because developing relationships with patients is always something that I have felt very strongly about and very passionate about. There's only 4 multidisciplinary clinics, so there's one at Stanford University, in Denver, and then in Cincinnati as well. So it's a little difficult for some patients to get to a clinic because there's not very many of us.
We really take care of a wide range of area for these kids. So
that we have not only our dermatologists, but we have physical therapists that come, we have occupational therapists, we have a nutritionist, we have a social worker, we have a pain team that comes, that's part of our anesthesia team. We have a pain psychologist that comes, and then we have physicians that unfortunately aren't able to come to the actual clinic every month, but that we refer out to. But we have a majority of them here, and they're able to come to our clinic. So patients are able to see multiple specialists in one setting and at one time, so they don't have multiple appointments.
It's basically our connection to, you know, everything we need with him. So any questions, any issues, and at times it's just, I mean, there's so many different things, but you feel like with having the connection to the hospital and having the clinic, there's always the help there. There's always, you know, a doctor, you know, and Group Kelly, and being so organized that we're just able to get, you know, anything that she needs. So, I mean, with all the issues with her throat and with her eyes, with her skin, with her bandages, it's all right here. So, yeah, I mean, there are so many things that, and it can all be at the same time. So, you know, when you're dealing with all this at once, everything can get kind of sorted out where it's not a big stress at home, where it's right, you know, here. So we can get her back to as much comfort as we can, as quick as we can. So it's huge that way. It really is. It's really important.
They actually put him in an isolation ward where all of the doctors who came in to see him had to put on paper gowns, and then after they saw him, they had to throw the gowns away because they didn't know if what he had they could catch.
EB is not contagious. That's a very common myth or something that people think. Other children cannot catch this disease from anyone else.
The most common transmission we see is autosomal dominant, which means lots of times you're the first person in your family that comes up with a condition. If it's EB, all of a sudden you have a baby, they're born with blisters. How did they get that?
Sometimes a sporadic or a spontaneous mutation will occur in the early stages of development, and that means that neither parent is a carrier of the gene. It was just something completely random that occurred, and there was no way to predict it, to prevent it. It just happened.
Or you have two parents both carrying one mutated gene, not showing the disorder, that then give that one mutated copy, both of them give that one mutated copy to the baby, and the baby has no normal protein, and that's a recessive condition. And then the other thing is, your mom, you have EB, and you have autosomal dominant type, and there's 50% chance you have a baby with EB, and you have a baby with EB.
When Riley was born, I was obviously very excited, you know, another boy, and everything went so smoothly. You know, my wife had a very normal pregnancy, unlike our first child, and everything about the pregnancy was normal.
I was just expecting this healthy baby boy, and it was pretty terrifying, you know, not knowing what's going on, and my baby's blistering all over the place.
Late in the first day or the second day, he was having a lot of problems eating, and we didn't know what was causing that, and it took us a while to figure it out. It wasn't until like after he started getting blisters, I know on his knees and a few other places, that we actually looked in his mouth and learned that his entire soft palate, the upper part of his mouth, was one big blister. I so wanted to be able to just do something, make him not feel pain, make it all just go away, but there was nothing I could do.
The doctors couldn't seem to tell us for a little while what was going on, so.
We brought him into the ER, and they ran every test imaginable on him. They drew, you know, blood and urine, and they did a spinal tap on him. They had ideas about what it was. They said it would take quite a bit of testing to figure it out, for sure, but they were pretty sure it was Epidermolysis Bullosa.
And there is nothing, and I mean nothing in life, worse than having a child that has a disease that you think is going to kill them eventually.
Sometimes you just have to be, look, this is the way it is. And you're right, it's not fair. It's not. And you didn't sign up for this, it's not your fault. You know, because a lot of parents will blame themselves. Well, it must be my genetics. Oh, it's my genetics. It doesn't matter whose it is. It's there.
I don't think I recovered until she was at least 2 years old. I really don't. I mean, it was that, I don't even know the word. I mean, it was just that devastating.
You know, when Riley was first born, and people would stare at him, and I would take notice of it a lot, and it really bothered me. especially the people that would look at me like I was abusing him, and they were judging without having a clue as to, you know, what we go through every day.
Come here. Can I have my hugs?
Or at most days, we will bandage his feet, as well as his knees and his hands. And the biggest reason for that is those are the biggest areas for him that he's experiencing friction on a day-to-day basis.
Anything that touches their skin cannot stick to their skin. Otherwise, they're causing more trauma. So they have a non-stick layer, and then they usually wrap with gauze, like a rolled gauze, and then they use like a surgical netting that sometimes you'll see like in a burn victim. Much of the dressing changes is very similar to what a burn victim goes through. So it's very painful, it's time-consuming.
From the prep and through getting him all done, it takes me about 40 minutes, which is, from my understanding, on the shorter side for a lot of kids with EB. Honestly, half the time I don't even see his bandages anymore because it's just, not that it's not there to me, it's just, I don't think about it because he's such a cool kid. He's just so fun to be with, and he's got so much personality that you just don't, when you're around him, you just don't notice.
It's hard when, you know, he's like, no owies tonight, please. And, you know, he has a large blister and we know we have to. Or, because if we don't lance those blisters, they get larger and larger. They just continue to grow. They don't stop. You know, and like, you know, a blister that, you know, if I got a blister, what they recommend you doing is you leave it alone. You don't cut it open, you don't pop it. But with kids with EB, you must do it, or else it just gets worse.
There's times when I'm like tearing up because I don't want to do it. And then he'll do it, so.
Yeah, there's times it's really tough. And you're like, I can't do it today, there's no way. And luckily there are two of us. I don't know how people who are, you know, single families, I don't know how they do it.
I think my worst experience would probably be getting blind, like having my eyes physically be shut, like swollen.
The dystrophic types, especially of EB, affect the mucous membranes. That involves the eyes as well, so they'll get corneal abrasions. So sometimes their eyes don't close all the way, or they've become scarred, and so they can't close all the way, and so they'll get basically a corneal abrasion is a scratch on the cornea.
Let's say like since they don't shut completely, they dry out, and that like tears for some reason. My eyelid kind of like messes with my eye and causes it to, you know, like get a wound or something on it that I have to heal.
Sometimes it's really painful for Lizzie because if she has big open wounds, and I mean, think about it, you know, any of us, we had a big open wound, we step into some warm water, it stings, it burns.
Basically, any contact with her skin can peel her skin off. It'll separate the two layers of skin, and so we'll give her a blister or a shred or a bubble.
I think he has a very high pain tolerance, because some of the things that he has to put up with, like especially on his feet, you know, sometimes his feet get really bad, and if my feet looked anything like that, I don't know if I could walk around. Riley's activity, his feet and things, for the most part don't slow him down. He might limp a little bit, so you can tell when he's in pain, but he'll keep going, you know, and there'll be times you can tell he's, you know, he'll have a tear in his eye, but still be moving along. He has, I guess on each foot, probably about 4 blisters or so right now. But for a while there, On one foot in particular, a section of it was completely covered in blisters and scabs. I mean, I'm trying to think how to describe it best, but it doesn't look like skin anymore because of how thick the scabs get and just the, I don't know, the look of the blisters and everything. It doesn't really look human.
Up there, that's thousands of dollars worth of bandages. I mean, each one of these boxes.
Insurances generally will cover the cost of their supplies. We can't always get everything that we would like because the bandages are so specialized.
There would be a little sheet like this that would go on her leg, and we'd use 4 of them at a time, and each sheet cost $50.
Like a regular Band-Aid, a lot of times will end up sticking to the injury. If you leave it, there, something that's, for lack of better terms, oozing or has liquid coming out, it will end up sticking to the injury.
Well, I mean, it's very expensive to care for a child with EB and to cover the medical expenses. We just found out for one of our patients, and her dressing supplies cost almost $11,000 per month.
Do you remember the little teeny tiny ones? Do you like the little teeny tiny ones? Yeah, we gotta wait for those to come.
Currently there is no cure for EB, but there is research going on. There's bone marrow transplants, there are some gene transfer therapies being done, and then there's a lot of wound care type research protocols that are being done trying to help heal these chronic wounds for patients.
It's just such an unknown genetic disorder, and we just need a lot more awareness. We need a lot more research into how you can help these kids and help them to lead a more normal life, and hopefully one day come up with a cure. Maybe it'll encourage somebody to go to medical school and study it, who knows.
So in our perfect world, there will be a cure, but it probably won't be, at the very least, until she's about ready to go to college. And she's only 4 right now, so we've got to wait.
There's becoming more and more awareness as the years go on.
Kind of get people interested in EB and just even expose them to what it's like and what it looks like. So when someone walks by and sees somebody in bandages, they don't say, oh, is that a burn patient, or things like that. So on a global spectrum, I think through art, through education, better job in medical schools, better job with physicians, because a lot of people have no idea what it is.
There was one time I went to the store with Riley, and I kid you not, 7 different people stopped me and asked me what happened to him. And I was in tears by the time we left because I just wanted to get my grocery shopping done. It's just, I want a normal life, and I want a normal life for him. And being constantly asked can get really wearing.
Noah, smoke protectors on. No, not good. No, Riley. No.
Was there a fire at the house, Riley?
I try to stay patient because I realize this is the millionth time I've heard these questions. It's the first time they're asking.
Smoke protectors on.
I appreciate it much more when somebody will be willing to ask the question, oh, what happened? That means a lot more to me than not asking and just staring.
Unless you know a family with EB, you have no idea. So I think awareness is a huge, huge thing. I mean, we all see commercials for certain disorders and fundraisers for lymphoma, breast cancer. EB is not on the forefront, and it should be.
I love you.
Remember, there's different severities of it. We have some kids that play soccer. We have some kids that play basketball. Some kids that deal with the repercussions of playing those kinds of sports, but some never go on to play those kinds of things. Some don't live a normal life. Many don't live a normal life.
Somebody has to take care of these kids. That's the hard part, Somebody has to do it. And there are not a lot of people that feel comfortable or willing to take on that role. So I'm thankful that the hospital really lets us take the time to do and provide this service for the community and these patients. Essentially, we were gifted the money to start the clinic, and we can't continue these types of programs and things without the support of our administrators and the support of our community and that funding that we get. There's no way we could do what we do.
Well, my shirt came from experience. It's kind of like I just wanted a reminder of, you know, what comes after a lot of the bad. Like, the healing is still beautiful. I have another one that's kind of funny. It says, "Don't act like you've never seen a scar or wound before. This is real life and self-acceptance."